Welcome back. This is Today right here on ENCA. Now, it's estimated that just over 60% of women aged between 15 and 49 use some form of contraceptive in South Africa. But despite education on their use, myths and misconceptions persist. And these include they're being told that you will gain weight if you use contraceptives. They will affect your ability to have children later on in life, etc. But for more on this discussion, I'm now joined by Dr Chido Siame, all the way from Kena Health. And it's important to have this discussion. So thank you so much, Doc, for joining me in studio.
Thank you, Tamelo. It's
Good
to be here.
Absolutely. And I think it's those myths, once again, that I'm sure influence, family planning decisions in South Africa. To what extent do they influence those decisions?
I think they really do influence the choice that women have in terms of family planning, in terms of falling pregnant, when they fall pregnant. And it's not just women that are partnered or women in marriages, it's young women as well. So, imagine you're told if you're on contraception, it's not going to be good for your health. Like you mentioned, maybe you won't be able to have children later, or you'll gain weight, or maybe it means you're promiscuous, kinds of things like that, Why are you trying to be on contraception? What are you trying to hide? And so then what happens then is that women end up getting pregnant unintentionally, unplanned pregnancies, and these have massive effects on a woman's health and a woman's financial situation as well. Even in terms of career or livelihood, all of these things have an effect.
Yeah, but Doc, where do these myths come from? Where do they emanate from? Could it be possibly because contraceptives were historically or previously shunned down upon?
Absolutely. I think, sometimes they would have started from perhaps a negative experience that a person will have, and they'll spread that as the gospel truth. If I have a negative experience, I'll speak to my daughters and my nieces and say, if you take the injection, this and this will happen. And it's not necessarily something that happens to everyone or something that happens a lot. But, these things then get propagated in the community. And of course, as it is with the spoken word, things get twisted a little bit. And then we end up with a really, really different, sort of situation on the ground in terms of information than what is actually there.
Yeah. You're absolutely right about it's almost like a broken telephone. When somebody has an experience, tells the other person, by the time it reaches the 10th woman, it's almost distorted so much that truth and facts are omitted there. But let's talk about the stats. What do they look like in the country when it comes to contraceptive use, and what are their impact? I mean, what do they tell us about the South African story and how contraceptives are either viewed or used?
Okay, awesome. So with women between the ages of 15 and 49, about 60% of them are using contraceptives. In that same age group, women that are married or in long-term partnerships, maybe about 68% of women are using contraception. So there's still quite a big gap there. But what we found, and the stat that, I think should worry us all, is that 30% of young girls between the ages of 15 and 19 years old will fall pregnant in that, age group. So that's 3 out of 10, almost sort of 1 in 3. That's a lot. That's a high, a high stat.
How important is then, education, information, awareness around contraceptives, particularly to this age group?
Really, really important, right? Because you'll take whatever you hear as gospel truth. If you see it on the internet, if you see it on Twitter, if you hear it from your aunts or from your community, you take that information. At that age, you don't sort of question it or interrogate it, right? So it's important that these young women have access to information, have access to credible, proper information from healthcare workers, and then they can make decisions based on what is right for them, the situation that they're in at the time. So it's really important to make sure that they have access to the right facts.
And perhaps can you share with us, what you are, perhaps even in your own capacity as a qualified medical practitioner, doing to almost demystify these myths, but also any organizations you're working with? It's already good and well you're here with us today to share, in this important conversation. But is there anything else that you are working on to ensure that you do provide that education around contraceptives?
So there's definitely a lot of good work happening in the space, right? Us at Kena Health, we offer consultations on our app, the Kena Health app. 120 Rand, you can get repeat contraception prescription. 185 Rand, you can speak to a doctor, a nurse, even a mental health care practitioner, but doctor and nurse in this context, right? And you can ask all the questions that you have, and then come to a decision to choose a contraceptive that is right for you, for your age, for your fertility intentions, for your lifestyle, right? And so we sit and we take the young women, any women actually, through that, and then decide on a contraceptive that works for them. They get a prescription, which then they can go and get at a local pharmacy. And then in the public arena, you know, the Department of Health does a lot of good work in trying to get information out there. But there are also a lot of private players and NGOs. You know, you have Love Life, you have Soul City, you have a number of NGOs that are doing work as well. Mary Stopes does work around reproductive health as well. So a lot of people working together, just trying to get the information out. And I think more and more trying to go to social media or other media channels to get the information widespread, because I think that'll increase access, it'll increase the information that people have, and then women will be able to make better decisions.
Absolutely. And I think often when you go to a medical practitioner, especially if you go to a public healthcare facility, you know, have a conversation with public nurses. At times we hear, you know, that there are negativities with consulting with a nurse, especially if you're a teenager or a young woman, whereby you're judged by the same health practitioner who's meant to give you that information. You're not feeling comfortable in divulging much because there seems to be judgment passed. And I suppose to you, how important is that space meant to be safe for these young women? Because if I'm afraid to speak to a teacher or perhaps a mother, you know, a parent or a guardian, and I only have a healthcare practitioner in the form of a nurse or a doctor, it's important for that space to be safe and educational at the end of the day.
Absolutely, it really is. And I think there is ongoing work in training healthcare workers to make sure that they're sensitive. I think sometimes, you know, healthcare workers are people at the end of the day, and you're in the community and perhaps your neighbor's daughter walks in and now you're shocked, oh, you want contraception? Why? What are you doing? And then the person takes on a mother role instead of the healthcare worker role. And it's from a place, it's not from a place of malice, it's from a place of care. It's just sort of misdirected. So it's really important, I think, the ongoing training that happens for nurses, for doctors as well, to remember that, you know, in this space, this is a safe space for this young person. This might be the only place that they'll get information and support and, you know, support in making decisions. So I have to make sure that I take off my mom hat and I put on my nurse hat or my doctor hat. And
also when it comes to, you know, awareness and education around contraceptives, is it only isolated to the girl child? What about the boy child? What's their role here in being informed about contraceptives?
I think it's really important. I think because a lot of the myths as well, you know, revolve around, you know, how there are sort of disparities in like gender, you know, power dynamics in communities and things like that. And it's important for boys to understand contraceptives, how they work, and to also have the myths demystified for them. You can imagine if a young boy thinks that if a girl is on the pill, it means she's promiscuous. That is immediately, you know, they view that young woman negatively, and it becomes a strain on the relationship. So that's important. Whilst there's not a lot of contraception that's available in terms of hormonal for young men, but the importance of condoms, I mean, that's a type of contraception, and that should be a conversation that is had with young boys to say that it doesn't mean that, you know, a person is promiscuous if they say let's use a condom. They want to be safe, they don't want to be pregnant. This is something that should be acceptable. If you are grown enough to be able to be having, you know, sexual intercourse, you should be grown enough to be able to have these conversations.
Absolutely. And I mean, we're having this conversation, Doc, because like I said, you also reiterated this. Teenage pregnancy rate in South Africa remaining quite a concern, with an estimated 30.7% of girls aged between 15 and 19 having begun childbearing. So when it comes to sex education amongst either teenagers, men, young men, girls, young women, I think it's important to also involve, you know, the male gender as well into this conversation. But thank you so much, Dr. Chido Siame, for joining me. It's been a pleasure having you right here today.
Thank you so much.
All right, that's Dr.